Good morning or good evening, wherever you may be. This is Lynn Turner, your host instructor for this chapter 15 on the endocrine system. This is the last part 3 of 3 for this chapter. And we're going to move down and talked about some of the other glands. We're going to talk about the pancreas, pancreatic islets, insulin, glucagon. We're going to talk about diabetes and different types of diabetes, and then talk about the testes and ovaries, and then the thymus and the pineal gland. I want to talk about the pancreas. Now, it is actually both an endocrine and an exocrine gland. How does it do this? Well, the exocrine tissue actually produces and secretes digestive juices, if you recall that from the digestive system, that go into the ducts, into the small intestine. Very important for breaking down and providing help with the digestion in that area. The endocrine tissue is where we have this pancreatic islets, different types of cells here called the islets of Langerhans, or you can call them the pancreatic islets. These are very important. There's A cells and there's B cells. The ones we hear about the most are secreted from the B cells, and that's insulin. The A cells actually secrete glucagon, and the B cells secrete insulin. There's also D cells that secrete somatostatin, and that's released actually along with the insulin. So insulin is secreted by the B cells. This is a typical normal thing when the blood glucose level is high. Now, when does that happen? Well, that usually happens after eating. The blood glucose level becomes high. You've taken in some nutrients and what have you. It has changed the blood glucose level. So insulin actually stimulates the uptake of glucose by cells in different areas of the body. So they take up glucose in the liver, in the muscle, and the adipose tissues, the fat tissue cells. And glucose is stored as glycogen in the liver and the muscle cells. Glucagon acts opposite to insulin. So it's secreted by the A cells of the pancreas. Remember, the B cells secrete the insulin, A cells secreting glucagon. It usually between meals. Now, it gets secreted when the blood glucose is low. And it acts on the liver to break down glucose and then enters the bloodstream. And it acts on adipose tissue to break down fat. So this is blood glucose then as a result rises. So again, here's another negative feedback. Blood glucose is low. We have this activity that brings the blood glucose back up to its hopefully normal position. There's a couple of terms here in your textbook referred to: diabetes insipidus and diabetes mellitus. They're two different conditions. This insipidus, it's actually a problem with the production of the antidiuretic hormone or the kidney's response to antidiuretic hormone. You don't hear about this one too frequently. The one that is the most common is the diabetes mellitus, or diabetes for short. It's due to the high blood glucose in the urine and taking excess water along with it. And we'll talk about how that happens. This one is most common. It's actually estimated that 25 million Americans have to deal with this condition. And there are different types, primarily type 1 and type 2 diabetes. Type 1 is also known as juvenile diabetes because it typically starts in younger years. And then type 2, also known as adult onset diabetes, that happens more frequently in older, not older people, but in adults. But you want to note that both can occur, type 1 or type 2 can occur in either children or adults. But primarily they act in those ages there. So type 1, what goes on there? Well, here the pancreas is not producing insulin, or it's not producing enough insulin. And type 1 is thought to be a type of it's still being researched, but it's believed to be that it might have an autoimmune disorder component to it. They think that it might be an exposure to an environmental agent such as a virus. Whatever that virus does, it causes the body's T cells to actually go in, and the body's own T cells to go in and destroy the pancreatic islets. Those are the ones, remember, the B cells produce the insulin. Well, if the T cells, your body's immune response, is going after trying to fight this virus, but it ends up it's actually destroying its own pancreatic islets, and therefore it cannot produce enough insulin. It actually has the body turn to the metabolism of fat because of the situation, and it leads to a buildup of these things called ketones in the blood, called ketoacidosis. And that situation can actually lead to coma or death. Those who are dealing with this must have daily insulin injections, because now the blood glucose level can swing between very high or very low. If it's low, it's called hypoglycemia, or if it's high, it's called hyperglycemia. So there's testing that needs to be done. Symptoms can be similar for either high or low levels of blood glucose, and they can include perspiration, pale skin, shallow breathing, anxiety. If these symptoms start to appear, the person needs attention immediately. Type 2 diabetes, again, is much more common. It's often associated with obesity. What's thought to be happening here is that the adipose, or the fat tissue involved with obesity, actually produces a substance that impairs insulin reception function. In other words, it can produce insulin, but the target areas can't receive it. Some genetic factors can be involved. So we're thinking there is this onset with obesity, but there can also be involved genetic factors. So, for example, it can happen more often in certain families or certain ethnic groups. Diabetes type 2 is actually more common in African Americans than it is in non-Hispanic whites. So the way to control type 2 diabetes, the first line, as you know, in type 1 we just mentioned, has to be daily insulin injections. Well, here it does not have to be that. It can be that, but the first line is to reducing the obesity, to adhere to a low fat, a low sugar diet, and exercise regularly. If that doesn't work, then the first line oral drugs is to stimulate the pancreas to secrete more insulin and hopefully to enhance the metabolism of the glucose. And then, of course, if that doesn't work, then they have to go back and try other lines, such like the insulin injections or whatever. But if it is related to obesity, then certainly this would be the first line that would be recommended. So how is it tested for? Well, the way it's tested is a person is given 100 grams of glucose to ingest. Um, and then the blood is actually measured at intervals. So the diabetic will have, in this measured intervals, we'll see that the blood glucose will rise a lot. It will peak up and then it will remain elevated for several hours. And they can also see glucose appearing in the urine. For non-diabetic people, after taking 100 grams of glucose, the blood glucose level will rise somewhat, but then it'll return to normal in about 2 hours. And that's what this slide or this illustration is trying to show you. When given the glucose, you'll see for those in the purple is indicating somebody with diabetes. Their blood glucose level will rise dramatically, and this going along this axis is time. So we've got 1 hour, 2 hours, 3 hours. They're still quite elevated after 2 hours, as opposed to the non-diabetic in this blue line, where you can see it does rise, but then it drops down back to normal or before the glucose was given. So let's talk about the gonads. The gonads are endocrine glands, and they're actually controlled by the hypothalamus and the pituitary. So it's quite the orchestration here. We've got target organs, target glands, and being controlled way up in the brain into different parts of the body. So it'd be ovaries in females and testes in males. And so this illustration is showing you the orchestration between ovary, estrogen, progesterone, hypothalamus, down into the pituitary, follicle stimulating luteinizing hormone. Same thing with the testes and testosterone going through the anterior pituitary as well. So let's take a look at the ovaries. It produces estrogens and progesterone. And these hormones provide feedback to control hypothalamus secretions in the pituitary, and pituitary follicle stimulating hormone and luteinizing hormone. It has many effects on the body. And we just say in general, the estrogen helps with the timing of puberty, stimulates growth of the uterus, the vagina. It's necessary for maturation of the egg cells. It's responsible for secondary sex characteristics and breast development. Also involved with regulation of the uterine cycle for the menstrual cycle. Testosterone, it keeps increasing, and increases amounts are released at puberty, and it stimulates the growth of the penis and the testes. Also involved with the male secondary sex characteristics, and for men the larynx and the vocal cords actually enlarge because of testosterone, and that lowers the voice for men. And it's partially responsible for muscle strength, the testosterone. If you ever heard of people who are trying to build up their muscles and they're taking anabolic steroids, anabolic steroids are either testosterone or related to testosterone. So they know that they're involved with building a muscle and muscle strength. I want to take a look at the thymus. Now the thymus lies just beneath the sternum, right in front of the heart there. And it's the largest and most active, again, at childhood. The lymphocytes that originate in the bone marrow actually pass through the thymus and they're transformed into T lymphocytes. So remember, if you want to remember that, just think of T, think of thymus starts with T, so T lymphocytes in the thymus. And the lobules of the thymus, they have epithelial cells that actually secrete hormones called thymosins. And these hormones actually aid in differentiating those lymphocytes inside the thymus. This is very important for the immune system. So these hormones, they aid in differentiation of those lymphocytes that are coming in there from the bone marrow. And that's another look at all those glands all over the body, and then the hypothalamus and the pituitary up here orchestrating with different glands throughout the body. And lastly, let's talk about the pineal gland. It's located in the brain. Let me take a look at this here. It's not shown on here. It's in the back here somewhere. You can't quite see it on this graph or on this illustration. But it's located in the brain, and it produces a hormone called melatonin. Melatonin production is usually at night. Its production is greatest at night during sleep because light actually, the existence of light or exposure to light actually suppresses melatonin production. So that ends the part 3 of 3 for chapter 15 on the amazing endocrine system. We talked about the pancreas and the pancreatic islets with those cells of Langerhans and those different A and B and D cells, insulin, glucagon. We talked about diabetes and different types of diabetes. Talk about the hormones in the testes and ovaries, also in the thymus, and then lastly the pineal gland.